Welcome to Domain 6. It's the last one. We're going to talk about confidentiality and privacy. Now, of course, you have learned about HIPAA's privacy rule and HIPAA's security rule because these are the two biggest guidance-loaded laws that directly have to do with what we do. Let's talk about them. All right. First, I want you to understand the difference between privacy and confidentiality because sometimes that can get confusing. Privacy was established by the Hippocratic Oath, and what this is the right of the patient, the individual, to keep information about themselves to themselves from being disclosed to anyone. This belongs to the patient. At the same time, we have confidentiality, and this is the obligation of the physician as well as all of us who have the privilege and the authority to look at a patient's private information. And this is essentially our promise, our oath, our legal obligation to keep the patient's privacy, to keep their secrets. Security, as you learned in the HIPAA security rule, is, all about protecting the privacy of the patient. But now we're not talking about something that was told to the physician that he needed to be sworn to privacy. We're not even talking about something then the physician wrote down in the patient's record that needs to be kept confidential. But we're now talking about something that is in a computer, not just on a piece of paper. And we're all very aware of the fact that securing information that is locked inside a computer is different than securing a manila folder that has a bunch of pieces of paper in them. Security measures have to prevent unauthorized access. In other words, somebody who is not legitimately permitted to see the patient's information should have no way to see the patient's information. But at the same time, we have to make sure that the patient's information is available to those people that need to have the information, because that's the reason we're collecting this information to begin with. Those two things are not on the opposite ends of each other. They are the same. It's all about being told a secret and keeping that secret versus those who should not know the secret at all. So the security terms that you need to become familiar with, and I strongly recommend that you review HIPAA's security rule summary, include the safeguards that are required by law, which cover hardware, software, personnel policies, information practice policies. Oh, and don't forget disaster preparedness, because stuff happens. Hurricanes come, whether you like it or not. Earthquakes come, whether you like it or not. And prevention of accidental or intentional disclosure to unauthorized individuals. So accidental is, oops, I didn't mean to leave my computer open to the patient's record. I had to run to the bathroom. Okay. Well, there are ways to prevent that with that automatic shutoff. Okay. Or intentional disclosure, which is when people are really looking to do harm. Healthcare information, which we know as personally identifiable health information. This is data that can be connected to one specific individual out of all the people in the entire planet. We can know exactly who this is talking about. There are items and pieces of data that do this, such as name, date of birth, address. Now, any one of these things by itself, there's lots of people that have the exact same birthday. There's lots of people who have the exact same name. But how many of the people with the same name and the same birthday have the same name and the same birthday and the same credit card number? Okay. And of course, the health data like height, weight, diagnoses, and procedures, medication. This is all personal stuff, and we have to protect it legally as well as ethically. Now, let's investigate who uses this information because, as I said just a bit ago, we have to make sure that we are keeping this information safe from people who have no right to see it, at the same time that we are making sure that it's available to those individuals who need to see it. So these are going to be the individuals and the reasons why it needs to be available. The uses for healthcare information include medical decision-making, resource utilization, legal compliance, certainly continuity of care, as well as reimbursement and research. The individuals who use this data include all of these people, the patient, of course, the physician and other clinical staff, the government, yes, pharmaceutical companies, third-party payers, the legal system, like in the case of a malpractice suit, okay, and researchers. So when we look at bringing in technology and combine this with the privacy and confidentiality of personally identifiable health information, what are we looking at? Technology plus healthcare. It gives us the ability to do such a better job caring for patients. And this has already been proven that electronic health records and interoperability and health information exchanges, CPOE, computerized physician order entry systems, and clinical data decision support systems have already proven to have saved thousands of lives. And that's why we're here working in healthcare, aren't we? So how can we possibly keep this all secure? Well, the first thing we need to do is identify what the threats are. And there are internal threats as well as external threats. Yes, external threats. You've heard of this malware and ransomware. I'm sure you heard about the WannaCry ransomware that caused so much havoc throughout the world, 150 countries, okay, virtually almost shut down the British healthcare system. This is serious, folks, okay? And then there are internal threats. Besides those evil people we mentioned before, they're just careless. I mean, we all make typos. That's part of being a human being. But the careless part is not double checking your work before you hit that submit button. Okay? Then there are people who abuse their privileges. Yes, just because I can access that patient's file doesn't mean I can legally or ethically look at that file. And of course, stuff happens. Equipment is not perfect either. Hardware, software, failures happen. So when we look at the specific health data, then we have to look at these three factors in regard to threats that may erode the integrity of the data, the reliability of the data, and the consistency of the data. And if you remember in domain 4, we talked about AIR, right? Accuracy, integrity, and reliability. And those concepts merge into these concepts of integrity, reliability, and consistency. Because if we're going to be making decisions based on this data, we have to make sure we're not building a house on a sinkhole. The legal protections, as I mentioned before, sit and stand with HIPAA. Not that there aren't other very, 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 very important rules like Stark and the Anti-Kickback and the Federal False Claims Act, but HIPAA is right there in our bailiwick because it's all about legally protecting the data of the health information of our patients. And while you may have had more focus on the privacy rule than the security rule in your education and your courses so far, now is the time to make sure that you are heads up on both. HIPAA's privacy rule discusses the use and the disclosure of protected health information. And if you don't know the difference between these two verbs, then you need to study them because they are important. HIPAA's security rule brings us safeguards, administrative safeguards, physical safeguards, and technical safeguards. And you can read all about these, like I said, in the HIPAA security rule summary. And also understand the job of the Chief Security Officer in addition to the job of the Chief Privacy Officer, because both are required under HIPAA. Okay, do you have any questions? You know what I want you to do, right? I want you to email your instructor or post to the discussion board. And if you have questions, 5 other people do too. And you don't want to be getting that one question wrong that you didn't ask about on the test and then find out you didn't pass by one question.